Stanford has released the results of the first nationwide antibody test, and it involved the A's and Giants. KPIX5's Betty Yu on what researchers discovered. Betty.
Brian, this test looked at MLB employees across the country, and it found that a very small number of people within the league have been exposed to the virus. The professor who led this study says this means that sheltering in place is working, and we're not very far along in this epidemic. The coronavirus has not spread widely in Major League Baseball, according to results from a Stanford-led study. It tested about 5,600 MLB workers, mostly front office staff from 26 clubs, including the Giants and A's. 60 people tested positive.
Personally, I thought there would be a larger fraction. From the antibody tests that we've done in Santa Clara and LA County, New York, there's other groups that are done in New York and Miami-Dade. We'd seen numbers more like 3%, 4%. In New York, it's 25%.
Just 0.7% of MLB employees tested positive for antibodies. Nearly half were asymptomatic. No deaths have been reported in the MLB from COVID-19.
And press the button and hold it to make sure it goes in. It shouldn't hurt at all.
This is one of the study's investigators showing participants how to administer the test.
What this suggests first is that it's, in some sense, more widespread than the number of cases we've seen across the country. The 0.7% is larger than that. So in that sense, it's more widespread. It's also not that far widespread at all. It's only 0.7% of the population of that MLB population.
Professor Jay Bhattacharya says MLB employees are not representative of the country at large. They are mostly white-collar workers and younger than the overall population. The survey kit had a 0.5% false positive rate. After the Santa Clara County antibody test, also conducted by Stanford, raised statistical questions over errors, Professor Bhattacharya says labs around the world offered validation data on the specific test kit used. This enhanced his confidence in the accuracy of the MLB results. The Stanford professor says he plans to send this study to a medical journal for peer review this week.